the most common surgery performed by heart surgeons in the United States is something called coronary artery bypass grafting. It's the original procedure that we had for blocked coronary arteries. Nowadays we have a lot of tools and techniques to correct heart blockages. Probably the one that most patients are going to be familiar with is stents, right? Coronary stents that are used to treat heart attacks or used to treat blockages and relieve symptoms. But it turns out that there's still a role for this somewhat old-fashioned way to revascularize hearts called coronary bypass, and that is by actually rerouting blood flow beyond blocked coronary arteries. Probably only about 2% of patients with coronary artery disease in the United States need something as invasive as coronary artery bypass grafting. And the way almost all heart surgery in the United States and around the world is done is by putting a patient on the heart-lung machine after they're asleep, which takes over the job of the heart and lungs. And we basically give the heart some of its own medicine to get it to stop beating. So almost all heart surgery around the world is done with the heart stopped, basically put into a temporary sleep state, so to speak, in order to work on the heart as it's still and patch up what needs to be fixed, and then you rejuvenate the heart and let it kind of wake up. Off-pump coronary artery bypass grafting is one of the few things that we can do in open heart surgery that does not require the heart-lung machine, and we don't actually stop the heart. So it's a way to do this very common operation, coronary artery bypass grafting, rerouting blood flow while the heart's still beating. And really what we do is use some special tools that have been developed to be able to stabilize the surface of the heart where the arteries live, and to be able to literally sew new bypasses into the coronary arteries while the heart's beating. If it sounds like it's a little harder to do than arrested or typical heart surgery, it is. And that's why it's only done around 15% of the time in coronary bypass in the United States. But that 15% is usually done by a smaller number of us super users, and I do about 99% of my coronary bypasses off pump. And it's a special technique. Not only kind of psychologically, emotionally, patients like the idea of not having their heart stopped during surgery. There are some actual clinical gains from this. The most important outcome of the chance of surviving heart surgery is the same between on-pump and off-pump coronary bypass, but some of the other endpoints that we look at, the rate of stroke, the rate of transfusion, kidney injury, time spent on the ventilator, all of those things are better with off-pump coronary artery bypass grafting, and there's even a mortality benefit that's been suggested for women specifically with off-pump coronary bypass. So it's something I've been doing for a long time, got taught this technique by some mentors, something I adopted a long time ago, and I think it's something really nice we get to offer patients. We all know that the off-pump technique especially benefits the sicker patients, patients with higher risk, and other baseline problems, risk for patients who've had previous stroke, patients whose kidneys are not functioning normally. But our philosophy, and those of us who do a lot of this, would say that you really want to get really good at off-pump coronary bypass before you start doing it just for the high-risk patients.